a.m., out the door, 8:10, breakfast at Jack's.
Start your day the Jack's way with a bacon, sausage, or smoked sausage, egg, and cheese sandwich. Choose 2 for $6. Jack's, all about the South.
Big stories, big views, only from Local Sky 3.
You know, we have come a long way over the years in finding ways to be comfortable talking with our doctors about sometimes some rather uncomfortable subjects. This month, doctors around the area and around the country are hoping that we will open up even more, because this is the month that we focus on colorectal health and cancer screenings. So Dr. Chelsea Ryan is joining us this morning. Neither one of us is going to blush as we have this conversation. She is with CHI Memorial Integrative Medicine Associates. Nice to talk to you this morning.
Nice to see you again.
Kind of ironic, on my way into work, I didn't realize this was going to be our topic today, but I heard a commercial on the radio about different issues when it comes to your digestive health. We are getting more comfortable talking about it, but still a lot of us aren't taking the action, right, Chelsea?
Yeah, and that's, and from a primary care standpoint, we kind of use that annual wellness to kind of snag up those people and at least have the conversation about colorectal cancer screening. So we really do try to take that opportunity to talk to the appropriate people, find out their risks, and figure out what screening might be best for them.
Okay, so do you recommend it like you do mammography and that type of thing at a certain age?
Yeah, recently in the last couple years or so, since I've been in practice up here, the USPSTF, which is basically like kind of the people that tell primary care, these are the recommendations based on research. They lowered the screening from 50 to 45. So now we start talking to the average risk patients at 45, but it's always important as any physician or primary care doctor to know the family history of patients, to know if they're at higher risk for cancer, where we might need to start screening earlier.
So, there are a lot of, seems like, ways to approach this screening. So you have the tried and true colonoscopy, but now there are other things that you see advertised. Are they as effective?
Sure. So, we do go ahead, and it's obviously always, the name of the game is shared decision making, and what is going to, you weigh your risks and benefits with the patient and things like that, and what is going to be the best screening for them. So just to kind of start out, like, yes, you said, the colonoscopy is our tried and true gold standard. The reason we like that one is it has direct visualization, and any polyps that, those are the things that we're worried for causing colorectal cancer. Those can be snagged up and sent for pathology. So we surely do, if a patient can tolerate that, and it is wise for them to get that, and we discuss it, and the benefits outweigh the risk, we really do recommend the tried and true. But like you said, there are a couple other ones that we discuss with our patients. If you've seen the dancing box commercial, the Follow Guard, so that's one that's delivered to your house. That way of screening is done every 3 years. And that's for your average risk person. So somebody who doesn't have like a significant family history or something like that, or polyps on previous colonoscopies, that's kind of something that you could talk to your patient about. And so that will come to your house, and you'll follow the directions and send it away, and it will be it'll test for some of the DNA that's shed for those from those cancerous polyps. So while there is some risk of if it's positive, you still have to get the colonoscopy. And there are some risks of having false negatives.
Okay. So you're talking about a family history. Is colon cancer maybe more than other types of cancers have a real strong genetic link?
So yes, there are some, there's a lot of lifestyle factors that go into that. So like diet, exercise, and if you have a history of smoking and things like that. So there's lifestyle things that put you at higher risk for colorectal cancer. But there are some syndromes that, patients, family members can have, that they have to start colonoscopies. It's usually either 10 years prior to the initial diagnosis, or 45 is the youngest, I believe. So, it is really important to know your family history, not only if they just had polyps, but if they had any familial syndromes that would put a patient at risk for having significant polyps. I'm
throwing you maybe a little bit of a curveball here, but I know on some of the notes that you provided, you mentioned high, like red meat and a diet low in fiber. We do seem to have a lot of people trending with trying to eat a lot of protein. And does that come at a risk then of not having enough fiber, or is that a concern?
I would say, name of the game is a well-balanced diet. We want you to have hot, like lean protein. We don't want you to just consume protein. We want your, if you look at the plate, like the healthy plate diagram, we do want a good, almost up to half of your plate being vegetables. So while we encourage good protein and lean protein, we want a lot of vegetables, which will include your fiber. So I don't think people are necessarily at higher risk for colorectal cancer when they increase their protein intake. But you do, it is for multiple reasons not a great idea to consume high volumes of red meat. It can increase inflammation and things like that. So well-balanced diet, well, it's not like the coolest, trendiest thing to talk about, but that's really, that's the tried and true for us.
Okay, I have a minute left. If you have inflammatory bowel disease, does that make you more likely to develop colon cancer?
Sure, that does put you at higher risk for colorectal cancer. So again, knowing family history in case we need to maybe be a little bit cognizant of asking you those questions that, taking a good history to make sure that you don't have any symptoms of inflammatory bowel disease, but also your intervals of colonoscopy, they decrease just to make sure that you don't, have those findings on your colonoscopy. So just if you have an inflammatory bowel disease, talk to your primary care provider about getting you in touch with a GI specialist.
And in terms of you at your practice, I know you do see the whole family. Are you accepting new patients?
Oh, always.
Okay, you can find her on Taft Highway on Signal Mountain. The phone number is 886-2004. She is part of the Memorial family. It is CHI Memorial Integrative Medicine Associates online. Simply go to Memorial's website, chimemorialmedicalgroup.org. Thank you, Dr. Ryan.
Nice to see you again.